windows, so if you have something, please just kind of shout it out or interrupt me.
Okay.
But our logo here represents the communities that are participating presently in Bright by Text. So last year when we launched it in Yellowstone County, we were joined by Bighorn County, Carbon County, and Dawson County. So we were kind of the 4 original partners. We spent from January to April planning what that would look like, and then we launched officially last April. So right now it's been a year. At the beginning of 2020, we were joined by a couple, 4 other partners. So Flathead counties, Mineral County, Richland, and Silver Bow County all signed MOUs to use it in their community and are on board, which is awesome. So Bright by Text, just so you know, is a texting service that's free to parents and caregivers, and it goes all the way from prenatal through age 8, and it's based on the date of birth of the child. And the goal is to really build nurturing relationships, promote child development, promote school readiness, and brain growth of children. So it has a lot of different domains. It's not just one area, it's a lot of different domains with using content partners. And it really promotes tips, activities, and then the thing that we really appreciate about it is their ability to include local resources. So this is an example of a local resource that we've been promoting here, as well as another program message. So I like this slide because of the histogram that shows you really the depth of content that Bright by Text has curated in their messages. So it started as an initiative in Colorado of some different sectors where they partnered to try to improve outcomes for children in Colorado. And then it was based in kind of an idea that everybody could use a good home visitor. And since that's not necessarily practical, you know, with all of us showing up in people's houses, what they did is they integrated technology into this model. And so it started for 0 to 5, but now, as I mentioned, it's prenatal all the way through age 8. And through this slide, you can kind of see how many messages a parent will receive each month in every different, on these different domains. So like, for example, at the 2-month mark, these are the different areas where the parents or caregivers would be receiving messages. So the messages are coming from, like I mentioned, content partners that you can see on the screen here, and also through Bright by Text's own working groups of experts who meet and who really dive deeply into the content and determine what is necessary and helpful for parents and caregivers. And that's one thing they want to make clear in their marketing, that it's not just specifically for parents, that caregivers can benefit from all of the messages also. So this is an example of some of the program messages that go out, and I just included some of the baby messages because of this group, the Healthy Mothers, Healthy Babies, and I think it's really cool how Bright by Text integrates a variety of domains and trying to include the social emotional components of parenting and caregiving, and not just, it's not totally focused on the child. So there are those aspects which I think are very helpful. Any questions or anything about that? So one thing to note too is that in all the messages, there is included a link that will take you to more information so parents can follow through on that if they are interested in learning more. And as I mentioned, the local messaging is what really excited us about this particular program and essentially sold it, because there is no additional fee. We pay one license fee and it includes basically as many local messages as we want to include in the program. So there are some guidelines that Bright by Text provides in order to standardize the messaging and in order to make sure that it's equitable and accessible to all families. So first of all the messages have to promote healthy child development, and then they really want to stress that it needs to fall within some of those protective factors for strengthening families. So as you're looking at the type of message content that you're sending out, it has to land within one of these categories. And obviously right now we're kind of seeing a lot of messages around concrete support in times of need, but obviously that builds social connections and other things, awareness in the community as we promote those things. And then it has to fall into, it can only be 140 characters. So anything else that you want to communicate it also has to include a web link, and you can include more, but just the basic information has to come through in the text. And one of the ways that we're using web links is through, it doesn't have to necessarily be a website. It can be a PDF that's online, a Facebook event. So there's a lot of flexibility that Bright by Text has given us. And I really appreciate that Bright by Text actually reads through every single message that we submit. So as the coordinator for the state project, I gather the messages from our local participating communities. I load those into the system. And at this point, I can kind of tell what is accessible to, or what will be approved by Bright by Text. But the benefit of it then is then it goes up one above me, and Bright by Text actually approves or denies the message, which I think helps maintain a continuity of experience for all families. And that's one of the things that we value about this. And additionally, the other thing is that we have noticed that these local messages are valued by families, and most of the local messages, the average click-through rate, so we can judge how many families are clicking through on that link through our dashboard. The average that we're finding is around 10%, whereas the industry standard is usually around 4% for clicking through on text messages that people receive on their phones. So that's awesome as we look at that data and we see what's happening with our local messages. So these are some examples of local messages that we have recently sent out. Shout out to Butte over here for their messages about trails. And so I've included who we sent the message out to, and we're able to filter the message based on that date of birth that's entered into the system, which is another awesome benefit, because if we have something in our community that we're promoting that isn't pertinent to everybody's prenatal to age 8, we're able to just focus it so that parents don't receive messages that they don't really need. You can see some of the most popular ones. I mean, the trail one in Butte was awesome. It went over like our 10%, which is our average. This one is one that went out about our mobile diaper bank, and that's at 23%. It went out to all of our 0 to 4-year-old families. This one for registration for Billings Public Schools, I noticed also had a really high click rate, which was awesome. And then this one was a message that I sent out, I think, a couple weeks ago when our story times went online. So you can see those tend to be sometimes a little bit less utilized. But one of the things we've noticed with the click-through rate is it's not just the click-through rate that we look for, because that's just one indicator of whether a family is engaging with this content. As you can see on this message, you could basically get the bulk of the information just through the text, and somebody could look it up on their own. So I think it's not a, you know, just because it has a higher click-through rate doesn't necessarily mean that families aren't accessing the information with the lower click-through rates too. One of the awesome things that I personally appreciate about Bright by Text is the variety of ways to sign up. So when we are signing up families, obviously you could sign up by texting the keyword 406 parents to this number, and this is the Bright by Text number that all the messages will come from, 27448. But what we found, at least within our project here within the last year, is that a lot of our families are actually preferring to sign up in person. So we have a form that we can use at events and at our partner agencies where parents just, I'll show you the form on the next slide, but they just basically have to fill out their cell phone number, their child's date of birth, and their signature. And then that form makes its way back to me, and I manually upload those into the system then. And I think that provides families a really great way to establish some trust with the system before they get started. So one example of where we've used that form is at the library and at different partner events around our community, and we've been able to sign up people through that. And then another way of signing up is through a designated online link where we have a unique URL that will sign parents up directly. So we can embed that in, one of the ways is that Our Best Beginnings Coalition sends out a welcome baby email to all of the new parents. And so we embed that URL into that email so that if parents want to click on and sign on that way, they can just enter their information, and then they're signed up and they'll receive those text messages. So this is an example of what that form looks like. And this is Anna. She's awesome. She's one of our part-time people that we hired, and she just has helped us get a lot of signups. This is at an HRDC event at the zoo where we actually gave out candy, and I think that day we got somewhere in the neighborhood of 50-some signups. because we were able to explain it to parents. And then the other thing to note about Bright by Text is that every message comes through in English and Spanish. Parents have the choice of which language they want to receive it in. So that also in the message translation for our local messages, they require everything to be in Spanish. And we have yet to find somebody in our team that can translate those for us. But Bright by Text is very collaborative, and they've been providing that translation for us free throughout this year. And so that's another awesome feature of Bright by Text. So I think we also value that Bright by Text evaluates and responds to what they find in their evaluations. And we've seen, this is one of the evaluation pieces provided by third-party evaluator Marzano, but just through this, they've been able to see that, parents are more confident because they receive these Bright by Text messages. They feel less overwhelmed. And then not only that, but the children are like ahead of kind of where other children are when they're utilizing the tips. And the cool thing too, in terms of accessing a population of your community for a long period of time, is this 95% retention rate. So if you think about a child or a parent signing up when their child is just born, or possibly even before birth, potentially, the community has access to that parent for 8 years. And so that's really remarkable that parents are staying engaged that long with this program. So I wanted to show you how we've been, one of the other features of their research is through this out a survey a couple weeks ago, and then they recently just collated that for us and shared it back. And this is just a screenshot of the Montana survey results, but I think what is another feature that we appreciate about it is that all of these are searchable. So I could actually look into seeing how our data compared to Washington's data or Wyoming or whoever else is enrolled in Bright by Text and kind of compare those numbers. But this allowed us to have kind of a snapshot of if the messages are helpful, when parents like to receive them, and in terms of local scheduling, which I do. Actually kind of fun to click through because even different counties had different preferences. So that was an interesting thing to look through the counties in Montana who are signed up and see certain counties liked it a little bit later, certain counties liked it a little bit earlier. I don't know what that says, but that was interesting. But what I thought was really valuable was this feedback here, that especially during this time, parents are wanting to get those actionable messages that they can do something with. And then also look at the number of parents who are interested in like stress management and mindfulness. Another cool thing is the COVID updates with 10% of the parents saying they want that. And I know that Janice put together a really nice local message a few weeks ago, and that had a pretty high click rate in Carbon County too. So it's just a helpful, and when I looked at this with the data from across the country, our data was really representative of what everybody else said too, which is pretty neat. And then there was a second screen on the number 4 where it actually allowed respondents to type in messages, and overall they just kind of reflected what this data says basically, but requesting more information or saying they wouldn't change anything, that they really liked the service just the way it is. This is a screenshot of the data dashboard that I have access to. So as the coordinator for the state, this is what I see when I log on. And unfortunately, it's not as robust for our local coordinators, but there are some pieces where local coordinators can go on and filter their signups by county, zip code, by the date of signup, all of those things. But you'll see here, the number on the left reflects the number of signups that we have using the 406 parents keyword. And in the parentheses, that reflects how many people across the state are signed up for this service. And then likewise, this reflects how many program messages have been sent to families in Montana and then across the country. And then community messages, and then messages across the country, and then stops. So I just pulled this like a few hours ago. So just locally or here in Montana, we've had 1 sign up in the last 24 hours. And then in the last 24 hours, 207 program messages, 40 community messages, and no stops. So the other, like I've been talking about the click-through rate, that is reflected right here on our program messages. And we can kind of evaluate that and see how it compares to the community messages click-through rate over here on the right. So the number of kids compared to the number of signups just reflects that you are able to enter more than one child when you sign up. You can have multiple children. I usually recommend in person that parents, if they have 4 kids under 8, don't necessarily enter all, because that's a lot of text to receive, you know, and try to, because the message will come through as C1, C2, C3, C4, so it doesn't even use their name. It can get a little bit confusing. So I usually recommend that they kind of pick the age range that they're most interested in, or they think will help them the most, and focus on maybe 2 signups or somewhere in that neighborhood.
Amity, can I ask you a quick question?
Yes.
That has been brought up before with a group of moms I've been working with, and we really debated on whether or not to do the age of the oldest or the age of the youngest. Do you have any recommendations, or have you gotten any feedback from what other parents are doing?
I haven't, you know, and I usually just leave it up to the parent, because sometimes with their first child or the oldest, they want to use that as, you know, their initiation into the program. And sometimes the 2 children are so close together that it doesn't seem to make a big difference. But sometimes they say, oh no, my youngest is giving me a real run for my money. That's where I could use the most support. So I don't have guidance on that from Right by Text, but I think leaving it up to them seems to be the best way that I've tackled that.
Great, thank you.
So one of the things is that we are trying to use this as a resource across our state, because we do see so much value in it. So we're inviting as many communities as want to join, to, you know, to be a part of it. That would be awesome to have everybody be a part of this. So one of the things that we do here at United Way, and as the as the Best Beginnings kind of wing in our community, is that we provide the technical assistance, and we provide the support for onboarding and the training. And you know, when there's turnover in staff at certain agencies, we kind of help them make that transition and keep the Bright by Text in their community, understanding what that local message is. An example is today in Bighorn County, earlier this morning, I just trained a new community coordinator and helping her understand like what this role and responsibility entails, so that she can easily enter local messages. Additionally, Kristen does an awesome job helping us coordinate all of our system grants, and, you know, really promoting it and getting funders, and to get it initially started, and then helping with the evaluation and making sure that we're able to report back, you know, to communities how it's working. So when we invite other communities, we ask that every community identify a project leader, and I see a lot of you on this call today. And with that project lead, we really ask that you kind of come up with a plan for how to enroll parents, because what we find is that in communities where you don't keep thinking of ways to actively promote it, it kind of hits a ceiling, and you don't go above that unless you're, you know, kind of being innovative in how you're going to promote more signups. And then through that also to set some enrollment goals and to do some marketing, and then to load the local messages. Those would be sent then over to me. And then we ask for a cost share so that we can all benefit from this without just one of us, you know, carrying that burden. So right now, Right by Text has a $10,000 license fee, and then with our coordination fees, it's about $25,000 a year that we cost share across the communities that are participating. So right now that's divided by 8, which is awesome because it's really reduced the cost for all of us. And we do that based on the percentage of the 0 to 5 population in that community compared to the overall percentage that's participating. So I think it is a pretty fair system that we developed in order to do that cost sharing model. So I don't know what happened here. So if you haven't already joined, we'd like to, you know, have you reach out to us and learn more about it. If you are wanting to just know more about Bright by Text in general, I've highlighted the website down there because they've been adding more to their website. So I think it explains the program a little bit better than it did even a few months ago. This is my contact information. So you could be in touch with either me or Kristen, and we can, you know, talk about bringing it to your community. Now, one thing I didn't mention is that anybody in any community across the country can sign up for free. I mean, there's no charge to any parent who signs up. The benefit to joining the partnership that we have and, you know, helping pay for the license fee is that it gives you access to entering those local messages and really connecting parents to resources in your community. And what we've found, just anecdotally, by those signups, like you saw the picture of Anna, when we're able to explain to families that this is a resource being brought to you by your local Best Beginnings Coalition, and we're going to be sending you local messages, that helps them sign on the dotted line. Like, there's a lot of resources out there that parents can already get. So sometimes there's some skepticism, but I've been at the library a lot of times when I'm going through a brief overview, and the mom, when I say to her, like, oh, and by the way, you'll find out about events and things that are happening that are free or reduced cost, she's like, sign me up. So I personally think that that's one of the things that we want to make really robust across our state by participating in a partnership. And the other thing about the kind of the quality control aspect of what we ask of communities to do when they're joining is to really have good experiences by all of our enrollees in Bright by Text, so that, as you know, we're kind of a big, small state, so people know people. And if somebody is signed up in a county and they are not receiving any local messages, the message that they're able to give won't be as positive as the message that hopefully somebody who's getting a variety of local messages will be able to get, because they're really benefiting from kind of seeing the depth of what their community has to offer and feeling very connected. Because we know that one of the stories that Bright by Text that my trainer has told sometimes is that, you know, different times they have stories of parents meeting at events and then subsequently meeting and running into each other, and then eventually forming a friendship and kind of being able to feel supported because they started going to events that were promoted by Bright by Text. So we know that happens, and we want just to make parents feel connected to each other and to their community through this resource. That's it.
Awesome, Amity. Thank you. That was an incredible presentation. I learned even more. I think I got to sit down with you and Kristen sometime last fall, and you talked with me about this program, and I was so excited, and came back and shared it with a coworker, and she was like, well, why don't we just sign up for it? And I was like, well, I don't have a kid. And she was just like, just make one up. So I have a Bright by Text fake kid that is now, like, I don't know, 15 months old or something. And that has really been a seller for me, just watching how you all are developing these messages and what comes out. They've never felt like a burden for me, and they're, you know, it's a text, so it's easy to be like, I'm busy, I'm not going to engage this, but then there's other ones that are much more engaging and you have time and space. One of the, I guess before I started asking questions, does anybody else have any questions?
I have a question.
Go for it, Alex.
Amity's awesome. You guys, if you can bring this to your community, it's great. We've really enjoyed it. And one thing is, when we mentioned it to other counties, we weren't sure if people would be able to join mid-year or what that looks like. Is that possible, Amity?
Yeah, I think it is, just because, you know, of the way things especially have developed. I mean, this is only one part of a role of my, you know, that I have in my profession. Right. So we were trying to limit it kind of based on the calendar year, just so that we didn't get too confusing. But I think just because of the way things are working out and my time is changing a little bit, that we'd be happy to visit about what that would look like pretty much any time, you know. So yeah, absolutely.
Cool.
I think one thing that I'm curious about is you mentioned that one of the best ways to engage parents right now is that person-to-person contact, and then mentioned a couple of other places. So, I mean, now that we're sitting in a place where we're limited on person-to-person contact, what are you, and then the other folks that are using this too on this call, what all are you doing in order to continue to get people to sign up, and how is that working?
Well, for us, we're not necessarily interacting in the same way in person to person, but I do know that like all of our home visiting programs and things have moved to this type of a platform. So I still encourage people to introduce it in this type of a way where they're explaining what it is and inviting a parent to sign up in person, even if it's not necessarily in an open space. But we are also able to promote it in a little bit of a different way over social media than we were before. I think before, there's a lot of, and there still is a lot of things competing for space, but when you can say this is a resource that, will help you with ideas and activities of what to do with your kids while you're stuck at home for weeks on end, I think that we've been seeing like just through that organic kind of way than we did before. And I think, just the nature of when something spreads and word of mouth and different moms are sharing it, at least in our community, with different people. So good question for us, at least.
Wonderful. All right, any more questions from the group?
This is Ned.
Go ahead, Ned.
I can just, hi. We got an article in our local weekly that kind of took that angle too. Like, now's a really good time to sign up for this, and hoping to see if I can sign up from that, or at least beginning awareness. So there might be a media bite. We actually lucked out because the guy contacted also has kids at home and is writing about it in his weekly column, what it's like to adjust to having two small kids and a working wife also at home to figure all that out. So working professionally outside the home in addition to what they're trying to do at home. So yeah, it was a good find for us.
Cool.
I know you guys have heard from me before on this, but just to pitch again, like how great I think this would be for us as a state, and how much sort of untapped potential there still is with Bright by Text, especially when it comes to creating local messages, because the messages can be so targeted by zip code. And we know that Montanans are so interested in getting their information from local sources, trusted sources, and that local in Montana doesn't mean somebody from Billings and Kalispell. It means somebody from Kalispell and Kalispell. And, if you're a Crow agency, it means somebody from Crow agency at Crow. So Bright by Text, Amity and I both feel we can't say enough good about the quality of this Bright by Text staff in Colorado and how they want to partner with us, and they're really open and interested to everything we have to say. And one of the things that we found we deliberately started this rural urban partnership with Bighorn County and Carbon County when we started, knowing that, the nature of Montana, again, that urban rural. And we just know that, of course, in a rural community, even in Billings, we struggle to get enough local messages sometimes about activities and things. And so then if you're living in a small community where there really isn't a whole lot, coming up with those local messages is very challenging, but we know families want them still. So we've had conversations with Bright by Text about, would it be okay for us? In general, they want the local messages to be about activities and things, and not the same content that they're already sending out, from their Zoom partners or their PBS partners or their Vroom partner. Mm-hmm. But when we broached the idea with them about, well, what if we have a local teacher or a local doctor or a local leader, a parent, a peer, tape a message about one of these things, what would you think of that? And they were all about supporting us with that. They'd like to see how that goes. They know it's just as important for rural parents to get local messages, as for any other parent. And so if we could, as a collective, get the funding to develop some of these local messages with our own parents, peers, our own, whoever, teachers, child care providers, doctors, nurses, I don't know, mayor, firemen, whoever, parents and kids want to hear from. I think there's so much potential there. And again, so these people, we can target them again by zip code and by age. So, I mean, there might be some Montana messages that would work for all of Montana, like the governor talking to everybody, maybe, you know, but there might be some that work. So I just want to throw that back out, like for people, you know, for your imagination to think about more of the potential that we have with this.
Awesome. Thank you. Thank you, Kristen and Amity, so much for continuing to develop this. It's cool to see it blossom. I like thinking about the possibilities of that, and I thank you guys so much for your work and for coming to visit with us today about it again. It was awesome.
Thank you.
Hey, this is Bree. I have a question for those of you implementing. I see a few of us that do state level work are on the call. For those of you at a local level, like what would you like the state focused folks to hear about what you could use in this kind of idea sharing, how we build this? You know, if you had any, what would your wish list be so we can champion that stuff?
This is Ned. Biggest wish for me would be continuation funding. We don't have to raise locally, and it lets everybody get in to the circle. Because I mean, we have a large percentage of the 0 to 5 population somehow in our area, so it was a pretty big hit for our budget. It's based on the size of the number of kids, but just trying to figure out how we're going to raise that again next year without a grant we have to spend really fast.
Did I hear
Interesting.
Amity say it's $25,000 a year for the whole state?
Yeah.
Okay, well that
I
sounds
don't
pretty
know
doable.
if that would mean, I mean, it feels like that would increase the workload a lot. So I don't know if that, you know, if you double the number of, or quadruple or whatever, that hits Amity harder. So it may take more coordination time. And you know, I want to keep the same great level of service she's been giving to me and to the Flathead. So for everybody, you know, so that would be just a consideration. It may not, the licensing fee is one thing, that there's coordination time to think about.
Sure.
But I mean, if it was $100,000 all in, that's a relatively small thing. If it bought every region the ability to use it, and then maybe I don't know what we do about areas where there isn't an existing coalition, but maybe the CCR&Rs could take over that sector of the state or something. So.
And
Thanks,
this
Ned.
is Kristen. I think that's very realistic what you just said. And that's earlier when we had the question, can people join mid-year? All the folks that joined us this year, when they joined us, we said we're going to have people join once a year. And like as Amity alluded to, the reason for that was try to control Amity's time so that we could, you know, onboard everybody in January and do, you know, 2 or 3 orientation calls versus 15 staggered throughout the year. And but like Amity said, you know, the situation has changed and a little bit with her time and stuff. But you're right, Ned, that coordinating this for the state, I think ultimately we'd need 1 FTE for the state. And then if there was an advertising, I would say the budget pieces to me would be 1 FTE to coordinate for the state. The license is $10,000, so we need that. And then a budget for each community, because there does have to be a person in each community who takes responsibility, and it does require time from them. So all of you all know that. You've all committed somebody, and they're the ones who have to organize the signups and the local messages. So I think that's what the budget would look like. And I agree with you, Ned, that $100,000 for the whole state on scale. And that's how we sold this for the first time around to funders, was on scale. Think how many parents you can reach, you know, for this amount of money, with how many messages. And back to what Amity said, with that 95% retention rate, if they sign up, you know, prenatally, or even they sign up at age 3 and stay on till age 8. And then the research behind it is very compelling in terms of the impact. So yeah, I think on scale of, as a state, if we could come up with 100, or, you know, and then some a marketing budget so we can get the word to parents and we can develop great local messages. Yeah, I would be all for that. And I don't think it's a huge cost, and I think it's a huge benefit. And then back to the data, we can track data really from a very granular perspective. even way more than Amity showed you here. There's just a robustness in the system. And again, a willingness in Bright by Text to do research for us and research reports. So they have all kinds of GIS technology where they can look at, you know, where parents are receiving messages, what messages they're looking at in conjunction with other factors like how many are on WIC, that kind of thing. So we could tap those features too.
Kristen, this is Bree. I have one more question. I was thinking about WIC and then you said WIC. Is there any other states where, because I know as a nation, the WIC participation is going down, and since it's an entitlement program, it's a very bad thing for WIC. Do you know of any partnerships of WIC and Bright by Text where they might devote some of their advertising money towards Bright by Text to try and recruit WIC participation?
I don't, but Amity, do you? I wouldn't be surprised if there was something we could ask.
Yeah, I don't know specifically, but I do know that in different communities they are partnering with WIC, but I don't know to what depth. But they're very responsive. Our communication with Bright by Text is very open. They get back to me like, so that is something I could ask and get back to share with you.
Great, thanks. And then I'd be happy to share with
WIC
Kate.
Our local WIC team is very involved locally. I'll just say that.
Yeah, I'd love to share it with Kate Gerard too and see if she wanted to put her head in it.
Cool. Very nice. All right, everybody. I think, let me see. So it's 4:22 right now. Just kind of thinking about a couple of other updates that we wanted to provide. I'm going to show you guys an art project that I did, and everyone can laugh. I will provide this for you. So I have really great GIS skills, just like those people at Bright by Text. And this is my map that I made in Paint. So we last week, or I guess that's actually 2 weeks ago now, just finished those call for the OD2A, the Connecting Early Childhood Coalitions and the Substance Use Prevention Task Force. We had 15 folks opt in, and those are all in the green area. So I don't have any like things for you right now, but we are kind of looking into what would it look like to get some of these orange highlighted areas added in order to make a more robust picture for what we're understanding at these local coalition levels. So I had just kind of went through and targeted these very quickly as like, I think I might know somebody that might be able to do this, and then I also think I might know, or I kind of feel like that's a pretty important population area in our state for one reason or another. So right now we're just working on finalizing kind of the granting, the money process or financial process with the state, and we'll be in touch with more updates about that. Bree, did you have any other things to add to this piece?
Congratulations on your beautiful art skills.
Thank you. I use Excel for a very good reason, everyone. This is not my forte. All right. Okay. So I think kind of, if we don't have any more questions on those pieces, I would really love to just take a little bit of time. Oh, Amity popped off. Dang it. I didn't even get to say hi to her. So I'd like to take a little bit of time and hear from each of the, start with our locals first, given that we have a little bit of a time crunch here, and just hear a brief, 3-minute update on what your local is doing right now, and that can be COVID related or not COVID related. I've got some money on one of those options. What you're seeing as needs and what you might need help with. And then I think it'd be really great if we could all share an aha. If you don't have an aha, that's okay too. But what in this process has been something that maybe has surprised you, or you feel like oh, I need to tell others this too, so that, you know, they see this as well. So anybody want to jump into that first?
You have a question about the map quick first?
Oh God. Okay, go for it.
It was a nice map. I'm sorry. I didn't get back to you, and you were very great in reaching out. The reason I didn't is because we actually have another source of funding right now. But I
Okay.
would like to be connected to the work.
That's what I
So
was
I didn't-
thinking we would say.
I didn't need the money, but I want to be part of the work. So can we make that
Yay!
happen?
I will put you on there. There was a reason I didn't have orange around that Yellowstone County. I was like, I think I know someone there. It'll be fine.
Yeah, we're there with you. That was a thing. Okay, thanks.
Thank you.
Yeah, we need you all. So I would like to be connected to all's working on this.
All right. Oh, Ned, what do you got?
Do you mind if? Yeah, and I actually have to jump off in a little bit, so I'm gonna, if you don't mind, I'll go ahead and just report. And Mary can certainly add in from her work too. So we had the immediate ability to move over to Zoom with our April meeting for our coalition locally here, and this call was a really good, primer for that to get used to doing that for a year and a half with a lot of people, and try to incorporate good discussion and that kind of thing. And so it was great because what we were able to do was really just share what's going on and update everybody. And I was expecting maybe 12, 15 people if we were lucky. We had probably as good as attendance, 20. I think we had probably about 30 people. I have to go back and look.
Yay.
Actually, even better in some ways than our normal thing. So if anybody's thinking about that, and it may be like that train probably already left the station for a lot of folks, but for us, it was just a really cool thing. And if anybody wants some pointers on how to use Zoom that way, I'm happy to just chat with you about that. And so the response was really around, our local response has really been around trying to get information out and provide hope and updates and that kind of thing. And I could give 1,000 examples, but basically it's probably what a lot of you are seeing, shift over to telehealth wherever possible. Where it's not possible, practice social distancing, contactless delivery, or pick up like art kits at the museum that you just go pick up, no questions asked, no screening, nothing, that kind of thing. So there's some really great stuff happening at a community response level. And from our early childhood perspective, as everybody is, just super worried about the restart of local childcare centers, small ones that are not, backed up by a bigger institution or even medium-sized ones. So there's a lot of concern around that we may need to revisit as a group. And thank you, Helping Others Healthy Babies and Montana Advocates for Children on all your work with that. This thing that I think Stephanie's showing on the screen, I just shared with everybody, and I'm happy to email it, came by way of an elementary school friend of mine on Facebook, and just randomly posted it, and kind of grew into something I shared with our local group. And then I've heard from a person in Scotland and another person in California that kind of share this. The person that created it doesn't want any credit. So it's a friend that I went to elementary school with who lives in Malaysia, and it comes to everybody as a gift. So if you have thoughts on this or reactions or desire to, let me know, but you're free to use this. And it's been a really cool kind of focusing tool for me and helpful in a lot of ways. So it's one part of the response. Yeah, a lot more to say about what's going on. So this was probably my aha moment, was like, all right, Ned, how are you getting in the growth zone, or at least to the learning zone? But also recognizing sometimes fear is actually a rational response to a new situation, and we should all be a little bit more fearful about everybody else out there, because we could all be silent spreaders, right? That kind of thing. So
Awesome.
take care, everybody.
Thank you, Ned. Yeah, it's good to hear you. And I saw this in the newsletter, and I really appreciated this piece.
Yeah. I'll stay on as long as I can, but good to see everybody.
Yeah, good to see you too. All right. Hearing from the Flathead. Who wants to go next?
I'll go quick. So Butte Community Council, really just sharing resources, information, supports, We helped disseminate the 0 to 5 parent survey. And yeah, just kind of spreading the information. Our kindergarten screenings have been put on hold, so just kind of, you know, keeping an eye on that and where that's going to go, what that's going to look like. And our next meeting for this month is on Monday, so just reassessing where we're at, what we want to do, or yeah. Pardon if I missed anything.
I think you pretty much got it. The only thing with kindergarten roundups and screenings is I'm going to do some outreach this week and connect with schools and see if we can even just get those backpacks to them, to the schools. And worst case scenario, if we decide to just cancel screenings for this year, they can still give out those resources. They have fine motor, gross motor, different cognitive pieces. There's an activity book in there. I think that'll still be really great. And then the other thing is we got 65 backpacks of our newborn backpacks up to the hospital.
Okay.
Yeah.
Nice.
So that way they'll have them and we don't have to keep going up there, or if anything gets worse, spread it. So
Yeah, you can do it all at once. That's awesome. Good problem solving there. Nice job. High fives to Jordan and Alex. Okay. Back for school. All right, who's next?
I can go, Stephanie.
Anna?
So in Missoula, hi everyone, I logged in late. In Missoula, a few things are happening. So I have kind of shifted out of my normal role to be a part of our co-ed emergency childcare task force, which is really working on supporting a coordinated effort around some pop-up care options and troubleshooting in case there is a surge, ways we can support healthcare workers that need, nighttime or kind of drop-in childcare in order to do their jobs. So we don't have a workforce shortage. And looking at ways to support childcare providers through that and kind of set up a system that supports existing providers as opposed to just popping something up alongside them, maybe a little of both. So that's taking up a lot of time. I'm also working, because our main event was canceled this spring, Healthy Start is not going to be doing a big training event. And so I'm putting together, in coordination with Healthy Start, resilience workshops for early childhood professionals. So Red Willow Learning Center here in Missoula is just going to do 2 hour-long sessions, one during the day for 9 to 5 employees and one in the evening for childcare providers that might want to attend in the evening, just for some self-care techniques and kind of self-regulation, and knowing that nobody really has a lot of capacity to learn new things at this moment, but maybe they can learn new physical ways to manage stress. And then I'm also looking into paying a mental health professional to coordinate some smaller group discussions of home visiting staff and potentially childcare providers involved in some of this emergency work. Just they're having a lot, my understanding is they're needing a lot of debrief with their supervisors, and it's completely not work related. It's just like, in order to carry the stress of the work, they have to let out some of the stress of their own life. So trying to do kind of a cross community home visiting sessions, so it wouldn't just be one organization, they'd be connecting with each other across organizations.
Okay.
And potentially we're still ironing that out because the sessions will be about 6 people each, so we need to figure out what the demand is. And then I'm working with Stephanie and our practicum student on our perinatal substance use project. We canceled our big network meetings that were going to be happening yesterday and next couple weeks from now, but we're really getting to dive into some interviews that we did and understanding kind of the different challenges and systemic barriers that are going on, so we can actually write that up in a more thoughtful report and take more time. So that was actually a blessing in disguise that we get to stretch that out a little more and be more thoughtful. And that is it, kind of concrete projects right now.
Wonderful. Thank you, Anna. Who's next?
I'll go. We also met by Zoom, Ned, and it was good. We actually have a grant that for our coalition that we're able to pivot to start figuring out how to use. And so we're working on a plan for how to help all of our early childhood, partners who are part of our Best Beginnings leadership team, get back to work essentially. So we're doing some planning on what kind of equipment we could potentially buy that would be helpful. We're just knowing that everything's happening virtually now, but as we begin to be able to open up gradually, what is it going to take for home visitors to get back into homes and for everyone to be safe? And especially when we think about vulnerable populations that aren't immunized or children with disabilities or so one of the things that we're looking into, and if any of you has any experience with this, I would appreciate knowing, is our school district bought some atomizers that they're using in their offices. Are you familiar? Anyone familiar with those?
Mm-mm.
Yeah, Mary? Do you have one? Sorry.
I heard that we are pursuing that in Kalispell School District, but I haven't heard more than that.
All right, also somebody
So
else.
we're looking at how we could potentially get some equipment like that would help our, as a coalition, we could get that equipment that could help our home visitors get back into homes. That and masks and how we can get those. So we've got some members working on seeing how our library is using their 3D print machine to make the masks that have the insertable filter. So we're just trying to figure out some things like that, like how could we get the PPE that's necessary for our our early childhood workforce to get back to it as things begin to open up. So that piece, so we're looking at that. We're looking at, of course, technology. We don't think we'll ever be going back. I mean, the world's going to be changing permanently, and one of the things that everybody's been scrambling to try to figure out is how to make sure everyone has the technology they need to stay connected and for every reason. So just looking into that, what would it really take to get iPads or phones or whatever, and hotspots and internet access for all the families that we serve, and just looking at that as a coalition, that we'd have more leverage if it's not all of us individually, but rather all of us working together. And we've seen some models from other states where people were successful working with broadband companies to get hotspots set up in certain neighborhoods and things like that so that's, I think we've really pivoted to that. And of course, there are the crisis needs with diapers and wipes, not having enough wipes and not having enough diapers. So we're really trying to pull together as a community on that and help our local diaper bank in this time, as well as the food. So we're also working with the co-ed, food, shelter, and all of that. And really that's pretty much the focus of our Best Beginnings right now.
Wonderful. Thank you, Kristen.
Hi, this is Dory from 0 to 5 in Lincoln County. And we've also been doing a lot of resource sharing. We created a community resource guide based off of a template that Cass designed and Carly helped design from the Butte Coalition. So we also help disseminate our parent survey. We're continuing to do our empathy interview process, but we're doing it now via Zoom or via phone calls. We have a parent who's taken the lead on that. Just helping out in a variety of different ways depending on what our partners are indicating their families need. We've done some emergency food support, help with diapers. We purchased some iPads for some kiddos who didn't have the ability to get iPads for their schoolwork. We're also helping to get the Hope of Mountain books out through our different preschools and like through the food distributions and through some of the homework packet pickups. So just trying to really support our partners and connect with them and just kind of work through, you know, the process of seeing that needs are emerging constantly and how we address those as they come up.
Awesome.
Lori, can I ask you a favor on your resource list?
There you go.
Would you mind sharing that so we can make sure all those resources are accurately put into 211?
Oh.
Yes.
Okay, that'd be great. And then just so you all know, if any of you have current resource lists, if you'd send them to me, I'll make sure they get where they need to get to make sure they're populated on 211 for the website and the operators. And then we've added a COVID-19 button on the website, and we're trying to be really attentive to having accurate hours and, you know, contact information if buildings are closed. So if any of you all in your programs have updates like that, if you just shared them with me, I'd make sure I get them to the right place for your county.
For sure.
Hey, Kristen,
Yeah,
that's really great. And actually, if you can share, maybe in the chat or something, share your website, because I'd love to share that on the 0 to 5 page. We've been sharing these community resource pages from our funded communities, but we have a blank template on our website as well. So I'll put it in the chat too if people just want to use the template that we've been using. But in that way too, Kristen, you can have access to not all 6, but most of our counties with all that good information.
Yeah, all the information you get to me, we'll try to make sure is reflected. And we've had a 70% increase in phone calls to 211. We're tracking COVID-related things as well. So we want people, wherever they call from, if they have access to phone, you know, the 211 phone number, we want them to have accurate information. So you all can help us make sure 211 is accurate for your region.
I'll make sure and put that in the body of the email when I send out these minutes, Kristen. 70% increase. Okay. Who do we have left? Miss April?
Hi guys. Our big coalition hasn't met yet, as we meet every other month. So that meeting's coming up next month. We had a meeting right before this all happened. And so that was our March meeting. But then our specific child coalition meeting, so our Family Connections Collaborative, sorry, so many different titles. We met, and working with Amy, our 0 to 5 coordinator, and our Parents as Teachers program, decided to start administering family kits weekly throughout our community at this point. And so one of the things we've been doing is coming up with family engagement activities. Parents had an opportunity to sign up and continue to sign up through our community. And we do doorstep drop-offs since our home visitors aren't visiting right now. Instead, we let the packets sit for 3 days after they've been put together, so they're fully cleaned according to processes, and we do the whole make sure everybody no germs kind of thing. But then we go and we drop them off at homes on the doorsteps, and families are encouraged to participate with them. We've done kite building kits, we've done bird houses and bird feeders. Every kit has some type of a social emotional aspect to it, and we've had a really good outpour of interest. You know, for our small county, we have about 120 kids, I think, right now signed up for that. And so it's 0 to 8, really. We've had a few older ones want in on it, you know, so we pair them with their siblings kind of thing. But it's been a really cool thing. And honestly, it's really helped our home visiting program because it's allowed my home visitors to still get eyes on their families and keep that connection, even if we're not going into the homes. In fact, we've had upswing in referrals lately for home visiting, which is kind of funny. And I think by the end of this month, we may have enrolled like 3 or 4 new families, which for us is huge. So it's been a very interesting time with doing virtual visits and everything, but people just really looking for that connection right now, and home visitors being that link to resources and those types of things. And we're also looking at a mental health grant right now that just came out with the state that some of the counties are getting asked to apply for. So we're trying to look at that and how it can supplement what we're doing with our families, and really trying to look at how we bring a mental health specialist maybe into the health department here and provide services that way through us for these families that we're involved with already with WIC and everybody else with our parents as teachers in our 0 to 5. So cool stuff going on.
That is super cool. I've been wondering about that, April, since you mentioned that last week. And how much of the 120 kids, I'm curious, are you guys doing any like online, like Facebook Live engagement? What kind of response are you getting there?
We haven't done the live for that specifically. Amy had talked about doing videos at first, and I'm not sure if we've done the live as much or not. But we are getting people posting all the stuff that they're doing and communicating. And so one of the weeks was the window art, people posting pictures of that. A lot of my home visitors have been able to use like the kite building activity. They did it via Zoom with their families. So they were on one end building the kite, the family was on the other. It was great for that activity for the home visitors to have something to do with their families. This week's bird feeders. So I think we'll go through some of the same things. Now for our families with littler ones, we encourage the parents to do that, or even our pregnant moms to build some stuff that they'll have for their babies, or talk about the social emotional stuff. So we're just kind of using it to move within those different age groups as best as we can.
Fabulous.
And yeah, so it's been good.
Wow. Anna says that one of their home visitors has also expressed a higher level of client engagement. Anybody else getting that in their communities? That's awesome. I think that's an aha silver lining in my book. All right. I think we covered all of our, oh wait, no, Janice. Did you want to give a quick update on what you're doing in Red Lodge and how transition is going to Brave New World? I'm unmuting you. Oh no, we can't hear you.
So my hand went across my little pad there, and like the screen went black, and I had no idea where you guys were. So
we're here.
Not a whole lot here. In Carbon County, everybody's doing really well, taking care of themselves. We have 5 childcare programs, and I've been keeping in touch with them a lot, following a lot of webinars, giving them resources and things. Out of the 5, 1 is open as regular, although they've added some school age kids, and they're trying to do homeschooling with them. So that's been a bit of a hassle. They are under a church financially, so they're okay. There's another one, we have one that's through Billings Clinic, Beartooth Billings Clinic here. They're open only for Billings Clinic workers. And they're doing okay. And the hardest are the ones, there's one that closed, and she's very concerned about how she's gonna reopen financial wise. And then there's another one that tried staying open, but her enrollment count is down so low, and she's just pretty much day by day struggling as to whether she's staying open or closing her doors. I trained and prepared for a virtual safe at home class to present to the 4th through 6th graders. And we had a lot of people look at the post and follow for details, but did not have one sign up. So we're not really sure. We're thinking timing probably was one aspect. We put it out the week the school age kids started their virtual home learning right after spring break. And then there's a $10 charge to participate. So we've regrouped. We're going to eat that charge, so not put a charge on it, and try to post that again to see if we have any interest. But that's kind of what I'm up to.
Very cool, Janice. That sounds like some good stuff is happening there. I would love to go to your Safe at Home virtual class, just so you know.
It would be really fun. Thank you. I'll invite you, Stephanie.
Okay, thank you. And then Erin had a quick update. We'll jump to our state partners.
Thanks, Steph.
Go sweat.
Yeah.
some folks have been referencing this. We threw out a survey for parents across Montana asking for parents' experiences really with children under the age of 18 living at home during COVID, recognizing that it's an evolving, ever-changing, and will continue to be evolving and ever-changing experiences. And we're gathering that data right now, and actually just messaged Steph. I'd love for her to send it out, the report. It highlights a whole bunch of stuff. And really our idea was this is just to gather data and then for you all to do what you want with it and follow up in your specific communities. We can also compile specific county or regional, depending on how much data we have across the state, snapshots to give you a better sense really of what parents are seeing. But really it's pretty, I mean, I guess it's not really surprising. It's like half of families are experiencing challenges with mental health and finding childcare or childcare closures, and that's leading to all sorts of stresses and then struggles to find health insurance. And anyway, so it's just stuff that shouldn't be surprising, but it's just good, I think, data to have. And I'm happy to be a point person. I'll throw my contact information in when I shoot it over to Stephanie, that people can follow up with me if they have questions. I did actually, Janice, I just wanted to mention really quickly that we didn't get any responses from your county. So I have your email, I've got an email drafted to you and I'm gonna send it to you. It's the report or the survey is still open and we'd like to hear more responses, knowing that it could be helpful for communities around the state. So I'd love for you to disseminate it out into your people.
Yeah, I mean, what I'm learning is it's a very tight community, and there's the several different small towns, and like school-wise, they're taking care of their own. It's this real tight community, and like the childcare isn't so much needed because the majority of them are home. So the majority are restaurant workers, are retail workers, small business owners. One thing that we do have at our community foundation, a COVID relief fund, and that has gotten the most activity because people are just really feeling that. But there's not like this huge need for childcare because everybody's just home. And so yeah, it's hard to know what the needs are. So I'm not surprised to hear that you didn't get much response. We don't get much response, so.
Mm-hmm. Well, yeah, not to pinpoint you specifically, but I'll send it to you and you can do whatever you want with it. But just to notice that
we can definitely see what we can do with it. Thank you. Okay.
I also just real quickly, Stephanie, I know I don't want to take up all this time, but April actually brought this to my attention. I don't know if you want to mention it, April, but there's a, grant opportunity, COVID-19 grant opportunity for behavioral health crisis response. Mm-hmm. Maybe folks are aware of that. There's some upcoming webinars about, I guess it's a $40,000 with the match needed, and it's for the next April. You know more about this than me if you want to chime in.
Yeah, I think mostly, guys, if you work for a government agency, I believe that's where it was available to, so you would check with them. I don't know if you have to be with the government agency. They might be able to partner with nonprofits on this. Okay. But it was specifically through the AMDD. So let me see if I can find it real quick. Sorry.
Here, I actually have it pulled up, so I'll put it in.
April, is that the SAMHSA
yes.
grant? And then,
yeah, the one
and they're giving, it's available to counties that did not get the county matching grant. And then there's going to be a different pot of money. No, the SAMHSA grant's for the ones that did get the county matching grant. That other one is for people who did not get the county matching grant.
Exactly, Kristen.
Okay, I know which one you're talking about.
It's up to $40,000 per county. They sent it to your commissioners and more than likely like your health department heads. So if you got in contact with them to see if they're applying for it, that's something to check into. Pretty broad range. I was sitting on the call before this as far as what they can use the money for, but they specifically want people with mental health needs and people with substance abuse needs. Those are the two main categories to help with, but it was a pretty broad range on how you can help them. So it's worth checking into with your county officials.
Okay, that's a good one. If you want to forward, I guess Aaron put that in the chat, I'll throw that into the minutes, and then also just make sure that that's in the information we get out. In our last 5 minutes, I need to honor a promise to one of my friends. She is doing some work with the Montana Nonprofit Association and had just a few questions and wanted to pick everybody's brains. These are really big questions. I'll just tell you that right now. We have 5 minutes, and so we'll have to be concise about it. So thinking about, how this CARES Act funding coming down to, deal with COVID responses, we need to use our voices and let people know how we want to spend them. And this is part of that kind of conversation. So the first question she had was, what does startup look like for Montana's childcare providers? So if you're starting a brand new childcare, if you're assisting someone in your community to do so, what does that look like?
Do you want that in the text stuff? Sorry.
You can do either. You can type it in that text or you can shout them out.
I was helping a person look into it the other day, and for us, because we're limited, we don't have the awesomeness of Butte and what those wonderful ladies do there specifically in our county. So we've had to kind of learn it ourselves through our home visitors and our program here as to what it looks like. So helping them understand the rules, what type they want to be, what applies to them, if they're going to need insurance or not, depending on the type that they want to be, that all goes into this area. And most of the time, the people that I know, they just want to be a small, maybe 5-child one, and so it looks a little different for them. But I would love to have somebody in our community more ready and prepared to help people just do it. It would be a great thing.
So more kind of like that child care resource and referral, the Butte Force type of model, having that more robust, not having home visitors have to figure out how to also do child. Yeah, cool. Thank you.
April, can I jump in really quick? So I have referred people to our R&R, child care resources, for that. And they do have people who are skilled at that, and I think it's a part of their funding is to support that. And they cover Mineral County as well. So it's
I love you, Ann. That's awesome.
Yeah, so I just would send them to child care resources and maybe follow up just to make sure they're getting the localized support they need. But I think they know what they're doing. It's so complicated. I feel like they're a really great resource.
Awesome. Thank you so much.
I got to piggyback. I think the R&Rs, they do cover the whole state, the R&Rs, but they're probably not adequately funded, because I know that our R&R here, it's like one person for a pretty populated county. So some of the things I've heard, so feedback, back to the state, if there were money, I'm all about putting more money into early childhood and especially childcare. I would fund childcare any day before preschool. I'll say that here out loud in front of anybody, but I think if we fully funded childcare, including our R&Rs, and got quality childcare for 0 to 5. So I think that may be a hang up in terms of, the R&Rs, like they are it, but also I feel they're inadequately resourced.
All right, I think that's helpful for me because and
it's not Jill's fault. I know, Jill. I know you and Sally have been fighting for this kind of stuff.
Get the monies. So then her next question was, what existing resources are available and helpful to support startup? Everyone's like R&Rs. Are there any other existing resources that you think on that community level? Jill, jump in. Okay, Jill's typing in childcare resources for April. Very nice.
Yeah, I think that certainly right now the resource and referral agencies are doing their best to get up guardianship situations for families that need it. Our frontline healthcare folks, they're really working hard on that. But I think that you're right, Kristen. I think that our CCR and our agencies are the best if you're looking for the most current and up-to-date information about what it takes to open a childcare. They're your best resource. And if you go to their website, it's the Best Beginnings Childcare. If you just type in Best Beginnings Childcare, you'll get their website, and it will give you a breakdown of the state map and which CCR and agencies cover which counties or support which counties. So that will help you if you're looking for that, to know which county is supported. So
Awesome.
outside of those folks, I think that was your question, Steph. Outside of those folks, I don't know. Nothing's coming to my head at this minute, but I'm going to give some thought to that for sure.
Wonderful. Yeah, if you come up with any great ideas, that would be great. Another piece, she had one final question, which was, how can the CARES Act funding best support Montana's childcare providers, including workforce needs?
I think that the last thing that you said is probably it. I think workforce needs is, I mean, that comes up a lot. You know, it comes up a lot. And I think that there are some, you know, there are some things that are happening. I've just been talking with the Early EDU Alliance about the things that they're trying to do to support the development of workforce. But I think that's a huge one.
Awesome.
Particularly when we're trying to think about quality. You know, the fact that you know, Kristen was mentioning we need more of them. We certainly do. And then when we have them and we're thinking about supporting quality, workforce is a big piece of that.
Yeah. Awesome. Okay, these are all things that I kind of thought, but I wanted to put them out to the brain trust. And so another thing that I'm going to do, that if you guys have more ideas about how funding should be spent, the governor's task force is asking people how this should be spent. And so I'll send out to our ECC listserv this afternoon or this evening the online response area. Your responses are limited to 900 characters. I would encourage you to browse who is on the task force. It's very business heavy. And just thinking about, like, how can we ensure that some of the early childhood interests, and then also you know, home visiting and all these different, you know, childcare areas of expertise that lie in this group can get voice within that. I think it's really important that we let them know what we think our really great ideas are. And I would encourage you to shoot for the moon in dollar amounts that you're thinking need to happen, and all of the things that you think are important, but do so within 900 characters.
All right. One of the things that I think that I'd love to see, and I know we got to go, but back to that broadband access, internet access, equity, I think that this is an opportunity for the state. And if there's ever anything that's pointed to the need for us to have that connectivity, it's COVID. Mm-hmm. And you can do so much telehealth. You can look for a job. You can do home visiting. And when you think about the rural frontier nature of our state, I hope that the government considers making sure that everybody has access to broad, you know, to internet, and then we can provide services electronically, and that they consider equipping our workforce to do that work, you know, electronically, including home visiting and all of that. And
Kristen, just to piggyback and just, I know that there's a tester's office in Dane's office. There's a telehealth, there's a broadband conversation happening. So it'd be a good time to write our legislators. Also, I was talking to Leslie Lee the other day. It sounds like Governor Bullock asked what home visitors need. So if people agree with Kristen, which I do, it'd be nice to kind of get kind of a united message out there as expand broadband across the state, invest in our access to internet.
And then if they invested in some things like, what did we say here today, $100,000 it might cost, or $150,000, to make sure every parent of children prenatal to 8 has access to Bright by Text. Like, that to me is a no-brainer, because then every single one of us can get the information we need out to parents on a regular basis and connect them with what's needed. Same thing with 211. To me, that's a no-brainer, that anybody should be able to pick up the phone and call 211, and we have one-stop resource referral, and we don't have to, you know, be creating 5,500 different ways. You just call 211 and you get a counselor, or you get whatever you need. So again, to me, that's really cheap. So
yeah, I love it, Kristen. Definitely, I think if folks are interested in kind of putting together, I'm not sure what the deadline, initially they had a deadline for like the Thursday for submitting feedback, but I think they're probably going to meet more times than that. So if there is a group within this group or a subset of folks that want to get in on, you know, composing a letter and being able to present that back to the group for approval, I think that would be really a wonderful action right now. People are asking for our input. This is not us strong-arming our way in. People want to know, what do we do? And we know that childcare is an essential piece of this work. That's become very, very clear. And letting people know how we think you can best support them is part of our work right now. So yeah, let's figure out how to get that done. And so I'll put out that email tonight with the, you know, the individual link to the task force and how you fill in stuff. And then I'll put in an ask for anybody who wants to participate in writing, you know, a quick letter that could be presented back to the ECC within a 1 week turnaround, I think would be our max timeline. We need to act quickly. And yeah, move on that piece. All right, everybody. How's everybody feeling now? Does everybody turn the oh, 2 thumbs up from April. All right. Thank you guys all so much. This brings so much joy to my day. I really, really appreciate seeing you all and hearing about your great work and passion. Yeah. We'll clap our way out.
Hey, guys.
Thank you.
Thanks, Stephanie.
Cheers.
Bye.
Bye, guys.
Bye.